Being the Community Connections Award winner is amazing. I love this community and I would do anything to make it a better place. And there's a lot of people that join me in that fight. And so to be called out is really humbling. At Heart of West Michigan United Way, our role here is to reduce poverty. And it's going to take a lot of different people working at a lot of different levels. I feel like I have great ideas sometimes, but they are made so much better by the team that's here. People that are willing to roll up their sleeves, to look at issues in a different way, and as a communicator, how do we find different ways to educate the community that there are many people around us that need a hand up, and if we all pull together, we can make that happen. I love learning people's stories, and when you start talking to others, you learn bits and pieces of their background that maybe aren't apparent. And I love being able to take someone that has a certain skill set and connect them where it's needed in this community. And there are so many places where your skills can be put to good use. Learning what people do and learning their skill set and then taking action. I think that is what my superpower is sometimes.
This award to us means that the community recognizes and supports the important work that we're doing around our mission and our values to treat everyone with dignity and respect and to have a culture that's inclusive of all culture and everyone in our community. We have very intentional and strategic partnerships with community organizations like Grand Rapids Chamber of Commerce, like WMCAT, like Talent 2025. That helps us identify and develop the talent that is needed for the healthcare professions today and the ones that we'll need in the future.
So here at Mercy Health, that's just who we are. When we think about the compassionate care that we provide patients every single day, it's regardless of their age, their gender identity, their ethnicity, or their cultural background. We treat all patients with human dignity and respect.
We envision everyone in our community finding their noble purpose. Everyone in our community belongs somewhere. If we're going to thrive as a region and as a community, we have to effectively become an organization that is inclusive and a place where everyone feels like they belong. We know here at Mercy Health that starts as early as the hiring and recruitment process. We didn't set out to be a leader in the community when we redesigned our hiring practices 7 years ago. We set out to make sure that we were putting the very best talent and most compassionate talent beside our patients. We were able to move the needle on diverse hiring from 18% to 38% in the last several years. And so to receive this high honor from the Chamber of Commerce just tells us that they recognize the importance of the values that we have here at Mercy Health.
I'm a firm believer that in he who has been given much, much is expected. And so I feel like leadership is a way to give back. That sounds very cliche. That comes from the heart. I mean that. I view, I don't have family here, I don't have children. Grand Rapids is my family, and this is where I want to spend my time and my investment. People don't care how much you know until they know how much you care. And I think being an inclusive leader from our skill sets that we learned in LGR, bringing people together is so important. It's really about being purposeful, taking the initiative, following through. I mean, these are some kind of like basic things we all should be doing. I know that in a town like Grand Rapids, it's a big, small town. People know who you are. So I know very well that I'm representing my family in the community. I'm representing Holland Home in the community. I'm representing the boards that I sit on, Center for Community Leadership, or Grand Rapids Civic Theater, the Grand Rapids Rotary, Strive Mentoring, whatever I'm involved in, I know that I have a responsibility to lead by example.
Yeah, to be recognized by your peers in particular, like people on their own deciding to nominate me is really an honor. I appreciate that greatly. Yeah, I mean, when we talk about systems, like systems are this kind of ethereal concept, but really systems are like people and history and kind of what comes from that history, right? To be able to really get in depth of, what it looks like to address poverty, what it looks like to address racialized infant mortality, the people who can make the decisions that are responsible for that, oftentimes that they inherit downstream, that requires some level of relationship. If you look at the root causes of health, we know that about 15% of health has to do with whether you walk into a doctor's office or not, and 85% of it has to do with things like where you live, the color of your skin, the amount of money that you have. And so Invest Health is really a collaboration between public sector, private sector, a lot of social sector organizations looking at how can we scale really good work that's happening on the ground to address these issues. There's something here that we can improve upon in this country. Because it definitely affects, from a spectrum perspective, it affects people's health.